This is AVM Superhero, and this is AVM Awareness Series. This is episode number 6. We have done 6 episodes so far, so I'm so excited about this one. I've been waiting for a long time to do this one, and I finally got one, everybody. I got a neurosurgeon to come on. That's the number one thing that we've been looking for as an AVM survivor, stroke survivor, TBI survivor. We look for people that specialize in our industry. So I have a good one for you guys. When I went to the Bekelis Foundation second annual gala, I met the people from the Stroke and Brain Injury Foundation inside of Long Island. So I want to introduce to you Dr. Bekelis. Let me just give you who he is, his little background story, then I'll bring him on to the actual show. This is pretty cool. So you guys could probably wonder why I'm so excited. So let me tell you who we have tonight. Dr. Bekelis is a board-certified fellowship-trained neurosurgeon with specialty training in minimally invasive endovascular neurosurgery. He additionally specializes in gamma knife radiosurgery and comprehensive or complex spine and brain operations. As one of the most widely published stroke researchers in the country with several national and international awards, Dr. Bekelis is a chairman of Neurointerventional Service for Catholic Health, the director of the Stroke and Brain Aneurysm Center of Long Island, and the co-director of the Neuro ICU at Good Samaritan Hospital Medical Center. Dr. Bekelis led the team that achieved the certification of the Stroke and Brain Aneurysm Center of Long Island and a comprehensive stroke center by the Joint Commissions, the only one of its kind in the South Shore of Long Island, in less than a year after inception of the program. So as you can see, I'm very excited about this one, guys. So let me see if I can find Dr. Bekelis and we can get started with our show. Give me a second and we will get started with this. You know how I do, everybody. I have to find them first, and then once I find them, we get started. So the invite is out. Let's see if I can find them. So on a Saturday night, as you guys know, my episode 3 was with Riley Dillon Cox. She actually passed away in September. She passed away in October 4th. I talked to her in September. She wanted to be part of this series, and unfortunately, she passed away before she could actually do the episode. Her birthday was yesterday, so she turned 18, and it was a very somber week, very somber month for AVM awareness, but her mother gave me permission to do a tribute to her, so we put all the information together, had her favorite song by Black Parade by My Chemical Pleasure. I believe that's the name of the group. And I put together this nice little montage of pictures of her, and it was pretty cool. So I'm glad that she actually allowed me to do it. And hopefully Dr. Bekelis can actually come on. I'll send him another invite. Let's see. One second, everybody. As you can see, I'm very nervous about this one. Can't even type right now. Let's see if he can find me. I send him another invite. Hopefully he finds it. It comes right on. But I have so many interesting things I want to ask him. And hopefully I can ask him these questions. And if you guys have questions about anything with AVMs and things of that nature, feel free to contact us and let us know. I'm getting messages from him. I'm not sure what they are saying because I'm live right now. I sent you a invite, Dr. Bekelis. Do you see the invite? To see the pop-up, just click on the pop-up and it'll bring you right into the live. Please be patient with us, everybody. When Dr. Bekelis finds the link, he'll be shortly on. He's trying to get on. He's in the waiting room trying to get on. So hopefully we'll get in any second now, and we'll be able to start this live. 1 second, everybody. Hopefully he sees this one and he could come in. So like I said, I met all the people from the Stroke and Aneurysm Center of Long Island at the Page Keeley second annual gala. It was a pretty interesting event. They actually honored me with the AVM Warrior Award for the things I do in the community. And I met so many great people, and many people wanted to actually talk with us. So one of the people was Dr. Bekelis. He wanted to come on and share all the things that he actually has for us as stroke survivors, AVM survivors, and people that's actually trying to prevent AVMs and things of that nature. So once I get him on, we'll talk to him about all that stuff. Let's give him a moment so we can find him. 1 second, please. Unfortunately, I can't find him right now. We will get him very shortly. Let me see what's going on with his technical difficulty on his side. Oh, I think I see him there. I just don't see him coming in. I see him that he's on the actual live, but I'm not sure how. Dr. Bekelis, make sure that you're using your cell phone. You would not be able to do this through your computer. Your computer will not. Oh,
hey, Greg.
Dr. Bekelis is here. How you doing, sir?
How you doing, bud? Good.
Dr. Bekelis, you scared me for a moment. I had to do a lot of tap dances for a couple of minutes, but I'm glad you're here. I know you had a busy day, so I really appreciate you coming on and speaking to us about AVMs and also aneurysms, and also what you're doing in Long Island to help us out as people that are worried or concerned about AVMs and aneurysms. But before I get started with the interview, I know I already did your little bio, and it was a great bio, so I thank you for giving that to me. But I want you to tell us, who you are and why you're in front of us today.
So, Greg, I'm a neurosurgeon. I trained in operating in the brain and the spinal cord, and I'm subspecialized in the treatment of blood vessel problems in the brain and the spinal cord. So, aneurysm, stroke, arteriovenous malformations, AVMs, which are obviously very important for us in this discussion, is what I generally do. And I tend to do everything from minimally invasive to larger surgeries, but the majority of what we do involves threading catheters and wires through the wrist or through the groin, and navigating into the brain and treating complex problems such as aneurysms or arteriovenous malformations in a minimally invasive way.
Okay, so you guys are located in Long Island, is that correct?
That's right. So I came to Long Island 5 years ago to start the Stroke and Brain Aneurysm Center of Long Island, which is currently the only comprehensive stroke center in the South Shore of Long Island. And that was a daunting task. We brought a lot of people with us, a big team that came with us to build this program. And this program involved not only creating a biplane angio suite where we can offer these minimally invasive treatments, but building a neuro ICU, significant nursing component. Over 60 new nurses were part of the hospital in the program, and then several other areas of the hospital that needed to be modified, and eventually an outpatient facility to complement this work.
Sounds pretty interesting. Dr. Bekelis, I've been doing these interviews for about 2 years, and it's very hard to get someone of your profession to actually come onto the show to actually explain to us, because there's a lot of us out there as stroke survivors, AVM survivors, aneurysm survivors, and any type of brain bleeds, want to get information, answers, and it's very hard for us to get it. So first of all, I very much from the bottom of my heart, I really appreciate you coming on and actually sharing your knowledge with us. Then, let's get into all of this. I met your company, your center at the Page Keeley Foundation second annual gala, and they was telling me there was so much information that they want to give out to the community. What we find from our side, I don't know how you feel from your side, but as a survivor, we find it very difficult to get that information that we're lacking. What can we do to bridge that gap? Is there any type of gap that you see in the medical side that's not going to the patients?
Yeah, so we deal with rare pathologies, right? So my whole specialty is it's common for us to treat aneurysms, AVMs, but in the general public these are rare diseases, and because of that the information is limited, right? And, breast cancer you get a lot of awareness, other more common diseases you get a lot of awareness, but AVMs or aneurysms you might not hear as much. AVMs in particular, and I like to say that, statistics are statistics, but even for something that's 1 in 1,000, if it's you, it's 100%. And so uh,
Right.
it makes sense to get that information out there. And so there's not a lot of us that do what we do. And I think that's the challenge that you're facing to getting that information out there. But I think that's where the role of organizations such as the Page Keeley Foundation is important, because they can bridge that gap. They can provide that connection between survivors or the general public, frankly, because that's, survivors know everything about arteriovenous malformations. The goal is to get that information out to the people that have never heard of the disease and who can potentially fall victims to it. So that's the important job that I think Gina and her foundation and other regional and national foundations are frankly doing. But it's not easy, as you said.
Yeah, because what I'm noticing, like for us, there is two foundations that I know of. You name one, the Page Keeley Foundation. There's another one called TAF, the Aneurysm and AVM Foundation. They based out of California, and there's only those two. So outside of that, there are so many people outside that and just don't know where to go to actually find great medical help or great medical advice. The question I have for you, that just comes off the top of my head, is as a neurosurgeon, um, how does this affect you when you see someone like me that had an AVM rupture and then maybe there was something that could be done that could have prevented that? How does
Right.
that make you feel, and what is there out there to actually make sure that people like me don't have these type of things?
So it's very challenging for us, right? To know that you can fix a problem before it becomes substantial, and then to not be able to. Obviously, it's the biggest challenge. I like to say that we are on the back end. We're glorified plumbers, right? We fix blood flow in and out of blood vessels, but the most important step is not what we do. Is identifying the problem before it ruptures, identifying an aneurysm, identifying an AVM before it's significant. And not everybody survives, but even the survivors obviously carry a substantial burden that's sometimes not even visible, right? But imagine the people that never make it, right? And especially for AVMs, that problem is across the board, across ages, and often in younger people. You see children die from arteriovenous malformations undiagnosed, adults. People are incapacitated, and then the survivors, like I said, they carry a substantial burden that is not always visible, and that's why support group is important. Support groups are important for survivors. But as far as physicians are concerned that do this job and deal with arteriovenous malformations all the time, it's heartbreaking, and all we can do, and for me it's very important. I made it one of the key missions of our center is to try to spread awareness, and we're spreading awareness through foundations like the Page Keeley Foundation, and we're trying to get the word out there. But kind of in parallel to that, we're working to increase screening and to increase the ability to detect these arteriovenous malformations before they rupture. We've been doing that for quite a while now, and I feel that we've making an impact.
Screening. What are you talking about with that? Because this is something new. I heard Gina Keeley, the founder of the Page Keeley Foundation, talking about that. But what are you specifically talking about when it comes to screening? Is it something that we can actually do?
Yeah, so there's very simple tests that folks can take. One of the most prominent ones being an MRA. That's like an MRI, very similar, but it particularly images the blood vessels of the neck and the brain, and it can give us information about the presence of an arteriovenous malformation pretty significantly. And the challenge with getting those MRAs is obviously insurance coverage for these tests, because it's not always It's not always easy to get insurance to cover for these tests. However, in the appropriate clinical setting and in consultation with us and with the appropriate signs, symptoms, family history, other issues, we can get those tests approved and hopefully identify something before it's substantial and maybe save a life.
Dr. Bekelis, I'm hearing exactly what you're saying, but like even for me, I was a instructional designer. Then I decided I was tired of the corporate world, so I got a half-ton pickup. So I was transferring RV trailers all across the United States. And before I had to do that, I had to take a DOT physical to actually make sure that I can actually drive the truck. So they checked my vision, they checked my balance, they checked my blood pressure, things of that nature. And all of that was fine, but they never checked my brain. You know, even when I went to high school, college, I played college football, high school football, never checked my brain. You know, what do we have to do to make sure that people start checking the brain? Because a lot of us are actually falling by the wayside because the brain is not being checked. So how can we trigger that?
You're 100% right, and I think through organized work through foundations such as the Keeley Foundation to create awareness, first of all, at the legislative level, where you can get folks that then can affect the insurance companies to pass laws that you know, under certain circumstances, screening is mandatory, because screening these days is simple. You know, it doesn't require anything invasive. You know, it doesn't even require contrast most of the times. It's just a simple scan, and I think getting through the stages of awareness and mainly through the legislative arm of the government, this is what's going to give us the opportunity to screen more people.
So let me ask you something, Dr. Bekelis. What would the typical symptoms for a person to have that you say, okay, boop, this person needs a screening because I know something could be happening inside of their brain?
Right. So there's a couple of things, you know, I think, and most of them work together, right? So when we make these decisions, we base them not only on one particular symptom, but important things, and you know, kind of going to give them to you at random, but important things are family history, new onset persistent headaches, new onset dizziness, changes in vision, new onset weakness. Obviously, this is a little bit more self-explanatory. Say if you're weak, you're probably going to seek medical attention. New onset numbness and inability to speak, possibly, or seizures. These are the big things that should be red flags, and you know, obviously, a series of tests will be done as substantial workup, and eventually, if an AVM is the culprit, then that would be discovered.
I want to tap into something that you said. It's not that obvious because a lot of people don't even know what a stroke is.
Right.
You know, for me, I was driving, and if I did have a friend that, you know, he had an aneurysm rupture, he survived it. If he didn't tell me what it felt like, I would have kept on driving. I wouldn't think about it. I just thought it was the regular headache and keep on going. So a lot of times people dismiss those things that you just said. Well, I had a seizure, you know, maybe I blacked out, whatever, you know, maybe I'm a little bit weak. You know, I worked out too hard. That's why I'm weak. But they don't really understand the significance of those particular triggers. So when you say that it's going to take more weight because you're a neurosurgeon, you're speaking on this stuff, and people will understand it. You know, when normal people talk about it, they don't really understand it, nor do they really speak about stroke in depth like they do about heart diseases or breast cancer, things of that nature.
Right.
So yes, I'm glad that you said what you said with these different triggers that you would say, hey, I need to do a scan on this particular person.
Right.
But even before a scan, is there anything else that can be done to make sure if a person does or does not have a AVM or aneurysm?
So, you know, it's tough before a scan to know what exactly is going on, right? There can be multiple different reasons why you can be having any of these symptoms. And the most important thing for obviously the general public is to, when you discover signs and symptoms of stroke, which can be an AVM, can be an aneurysm, can be multiple other things, but whenever you experience or see somebody near you experiencing signs and symptoms of stroke, and actually the American Heart Association has created an acronym that is pretty easy to remember. It's called FAST, which stands for Face, Arm, Speech, Time to Call 911. So you know, if you see changes in in your face, in your arms, in your speech, then it's time to call 911. And that really, I think, drives the message home in terms of, if you're seeing any neurologic change, time is of the essence. Time is very important. So there's not a lot of time to think about it or go to sleep and see how you're going to wake up the next day. This is a time for action. And in particular, when it comes to aneurysms and AVMs, an additional symptom, in addition to the face, arm, speech, from the FAST acronym, in addition to that, when it comes to brain aneurysms and AVMs, what really people need to understand is the significance of a bad headache. And the headaches typically related to arteriovenous malformations that rupture or aneurysms that rupture are very stereotypical. They tend to be the worst headache of somebody's life. They are thunderclap in nature. It's like somebody hit you in the head with a hammer, and they go from 0 to 100 in a split second. So that's something to really understand. It's probably the most important sign and symptom when it comes to a rupture of an aneurysm or even an arteriovenous malformation in the brain. And this is, if your viewers remember one thing, that's probably the most important thing.
Yeah, because all the other symptoms I didn't have, but I only had that excruciating headache, and I knew right then I was like, "Wow, I'm about to die." So let me pull over because something really bad is about to happen. Because this is the worst headache I ever had in my life.
Right.
But let's go back to that. I heard before in the medical terms that the AVM was like a pediatric type of condition. A lot of little children have it. So when I was younger, my mother took me to the doctor because I was having a lot of seizures, and the pediatrician said, "You know what? Just give him some seizure medication and just send him on his way because we don't want to mess with this young strapping, young strong boy and start drilling inside of his head." What do you say towards that when that happens?
So, obviously, the correct approach, obviously, is when you're having seizures to investigate further and see what's going on, especially in a child that has resistant epilepsy or seizures that are resistant to medications. Now, we call arteriovenous malformations a pediatric problem because they're congenital. Most people are born with arteriovenous malformations that subsequently, over the years, develop, and eventually they rupture at some point. They can rupture when somebody's a child or later down the line. They have a standard risk of rupture per year, and there's no telling when one is going to rupture and when one is not. And obviously, we would want to identify them as early as possible. Now, if somebody's having seizures from an arteriovenous malformation early on, it's almost a blessing in disguise because you have the opportunity to identify the arteriovenous malformation before it ruptures, right? Because some people are not lucky. They don't know about the AVM. It sounds like in your case you did have the signs and symptoms, possibly, but regardless, the AVM ended up. You weren't aware of the AVM; it ended up rupturing later down the line. But this is I guess a missed opportunity. When you're getting those signs and symptoms early on as a child, it's very important to get them investigated further, because there can be several reasons why you might be, for example, having seizures. AVM being one of those reasons.
Dr. Bekelis, I'm trying to make sure I understand because I want to make sure that people really understand what you're saying to them. So are you saying, or are you implying that anytime that a person has a seizure, that's a red flag that they should get a brain scan? Is that what you're saying to me?
So yes. So an adult that's having a seizure is definitely a red flag. They need a scan. In children, typically the first seizure, folks would not get a scan, but obviously if there's persistent seizures, if seizures are resistant to medications, then they would get a scan. But in an adult, a seizure should always trigger a brain scan.
Okay, okay. So that's good information. Is there anything else that, like you said, the numbness and all that stuff, but when I was talking to Gina, she was telling me that she's trying to get a panel of screening done to be mandated inside of the state of New York. Do you know anything about that panel and if it's going to be
Yeah.
something that's going to happen?
Yeah, so we've been talking to Gina a lot about this, and she's very passionate about it because there's a particular subset of arteriovenous malformations that are syndromic, that are part of a general, gene mutation that we can detect in a test, in a lab test, and those obviously that's a substantial opportunity, right? So those folks, if we're screening for those genes like we are, every time somebody gets pregnant, there's multiple. The majority of the people, they get the genetic screening, and when they do, there's a plethora of genes that are being tested. I think Gina is trying to integrate that as part of that screening, and it's important if we're able to achieve that. Again, there's a lot of fighting in the legislative front that Gina is undertaking to try to get that through. But if that happens, then I think a subset of AVMs will be discovered very quickly, because that these particular individuals that are testing positive for those genes are at higher risk for an AVM. Therefore, you can screen them with an imaging study like an MRA and identify the AVM before it's a problem. And these days, treating an AVM is extremely straightforward most of the times. We have multiple different ways, multiple different tools where we can treat arteriovenous malformations with. There's the classic open surgery where we open the skull and remove the arteriovenous malformation completely. There's other ways, endovascularly, for example, through the wrist or through the groin, where we navigate our catheters and wires inside those arteriovenous malformations and block the abnormal connection between the artery and the vein, because that's what an arteriovenous malformation is. You use special type of glue to seal down that connection and shut down the malformation, shut down the abnormal connection, and turn the risk of bleeding to zero. And then the last option is stereotactic radiosurgery, where you hit the arteriovenous malformation with a single shot radiation that then over time makes the blood vessels shrink and eventually shuts down those abnormal connections. And these three different treatment options are not mutually exclusive. Very frequently, depending on the complexity of the arteriovenous malformation, depending on the situation of the age of the patient, and a million other factors, we choose a combination of those approaches. So often we embolize an arteriovenous malformation through the groin with glue, and then we'll remove it to give somebody a sustained effect of the treatment. Or other times we do radiosurgery in a large arteriovenous malformation that then shrinks to a very small arteriovenous malformation, which then we can take out or embolize and completely obliterate. So we have so many options, and it's a missed opportunity to not be able to fix those problems before they become catastrophic, before a bleed that can change somebody's life or take somebody's life.
Right, right. I had two of the three of those options. I had the embolization, then I had a craniotomy done to me. So I understand basically what that feels like, and I've been through it. So let me ask you, because I know that you are a neurosurgeon, but after your patient has done the craniotomy, radio knife, or radio gamma knife, or embolization, what kind of connection do you have with them afterwards? Do you still connect with them, deal with them in part of their life?
So a lot of these diseases, the patients end up becoming our best friends because we see them for the rest of our lives, and follow-up is very important. And follow-up on the medical side, in the office, obviously with scans every so often after treatment. Depending on the impact of the treatment, depending on what's, if there's any residual pathology, if everything is gone, but certainly there's a lot of follow-ups that happen. And then in addition to that, which is obviously a more formal interaction, and obviously the patients can always reach back out to us if they need anything in between the intervals that we follow them. Another very important thing that we're doing is a very active support group. Our support group encompasses it's not specific to arteriovenous malformations, but it has folks that have survived arteriovenous malformations, aneurysms, and strokes. They're all together, and they share stories. And sometimes what we do on the physician side, I hate to say that, but it might be relatively superficial. We look at a scan, the AVM is out, right? The patient's looking good, they're strong, what have you. We feel good about what's going on, but that's where the support group comes in to fill that void of understanding what's really going on sometimes with these patients. And the trauma from an AVM rupture or an aneurysm rupture sometimes is a lot deeper than can move all four extremities strongly, and the scan looks good. And a lot of survivors have survivor's guilt, or even, they have fears that we cannot address in an office visit. And that's how these informal settings and these support groups really make a difference. And I'm very proud of our support group and the work that it's done, both for aneurysms and arteriovenous malformations at the local level, obviously. But we've been running that support group. Jason, who you've met, has been running that support group for the last 5 years, and I think it's helped a lot of people. I'm certainly very proud of that aspect.
So that question I just asked you was a loaded question, because I have a follow-up question behind that. And from your professional opinion, when someone has a brain bleed, um, do they, even if they are physically able and willing to do things in life and things, whatever, are they 100% back to normal again, or is it always a stroke survivor? Because there would be people that will say to me, even like, "Well, you blaming it on the stroke." I'm like, "No, I'm not. This is my life now. This is how I think. This is how I act." Is that true, or is it we just talking fables?
So an aneurysm rupture, an AVM rupture is as a life-changing event as can be. It's a near-death experience, right? So there's no more traumatic event than that. And for those who survive, the trauma doesn't go away immediately, and often it doesn't go away at all. And as I said, it depends on your definition of doing well or being fine. Depends on what you mean by fine. And if we're looking strictly at the medical side of, I'm very strong, I can move my arms, my legs, I understand what you're telling me, I can speak, which is kind of what a neuro exam consists of. That's one thing. But how somebody behaves, how somebody understands the world, now having been through that experience and through that light, is very different. And that's why support groups are so important. And I keep coming back to that point, but support groups are important because in an environment of understanding and in an environment of other survivors, you can really heal. And healing is not something that happens and stops. Healing never really stops when it comes to survivors. This is something that folks will carry with them all their life. And
Right,
frankly,
right.
that's why folks keep coming. I've had patients that have survived an AVM 5 years ago. They keep coming to our support group. It doesn't mean you survived, you're looking great, you go once, you're cured, off to the races. That's not really how it works. And the reason is that even simple things. I mean, there's a lot of things obviously that I cannot explain or understand because I haven't been in your shoes. But certainly simple things like being afraid that this is not that this can happen again, possibly. That can really change your life dramatically. It can change the decisions you make on a daily basis. Can change what you're thinking about, what your motivations are. Can change your priorities. So really, we cannot discount how survivors feel, and that's why, as I said, support groups are the cornerstones of healing this population.
I am so glad and relieved that your organization is actually fully comprehensive to the full gambit of what happens to a person from nuts to bolts of an AVM rupture. Because a lot of us afterwards, we don't know how to move forward. And you saying that you guys have this support group, I can just imagine how great that is. Because the first thing that happened with me, I was the breadwinner. My wife didn't work for the last 10 years. Then all of a sudden, in the blink of an eye, I can't comprehend anything. And now she has to take care of me. She has to take care of my children, and she has to go out to work.
Right.
How do you handle that? As a man in his 40 years of age, I'm used to doing all the things that I can do, and I can't do that anymore. And I have to rely on someone else. I have to automatically change from quote unquote an alpha male to something else, to a patient. So I'm glad that you guys do that. And that's very refreshing to me. Thank you so much. But we're at the time of the show that we asked our guests some quick fire questions. And after these quick fire questions, I have my guests close out the show. So before I get started with this, I want to let you know that these are very, very tough questions that we like to ask our panelists. So please give us a comprehensive answer. No more than 30 seconds. 'Cause I like to throw these into video clips on YouTube, Instagram, TikTok, so and so on. So, Dr. Bekelis, are you ready to be on my hot seat?
I am ready.
Let's go. Let me ask these questions for you, sir. All right. Whenever you're done with your answer, just say, Greg, I'm ready for my next question. Let's do it.
You got it.
What should a person with a diagnosed AVM be concerned about?
So they should be concerned about the possibility of rupture, obviously. So again, the most important thing would be recognizing the signs and symptoms of such an event. And top would be the worst headache of somebody's life. That's something that they should very much be looking for. If that were to happen, immediately call 911, go straight to the hospital. And then obviously general signs and symptoms of stroke, like we discussed before, face, arm, speech problems, seizures, those would be the signs that they should be worried for. This is what they should be looking for.
Okay. Dr. Bekelis, question number 2. What should a person do if they think they are having a brain bleed?
The most important thing is to call 911. This is different from a heart attack where, the recommendation is take an aspirin, go, call 911. In this case, the most important thing is to get to the hospital as quickly as possible, and 911 is the way to go, in particular because ambulance crews know where to take you, where there are capabilities to treat you. Going to the nearest hospital might not be appropriate if there's no neurosurgeon, if there's no neurointerventional center there. They need to take it to a comprehensive stroke center. So again, call 911.
So, and this is just a continuation of the question. So basically you're telling me it's very important that you call 911 so they can get you to the right hospital, and also time is of the essence because every second that you lose, you could be damaging your brain more. Is that correct?
That's exactly right. So, call 911, they'll take you to the right place every time. And then we like to say time is brain. So the quicker you get to care, the higher the chances to preserve your brain.
Okay. Question number 3. Can you have an AVM or aneurysm anywhere else in your body?
Yes, they can be throughout your body. Obviously, the most catastrophic ones are in the brain. They can have a dramatic impact and they can kill somebody when they rupture, but they are prevalent across the body. In your chest, in your belly, even in the legs, you can have aneurysms or arteriovenous malformations.
Okay. Question number 4. Are AVMs/aneurysms avoidable?
They're not necessarily avoidable, but a rupture is preventable. So, most of the times an AVM or an arteriovenous, an AVM or an aneurysm is an event that you cannot avoid because it's in your genes to develop something like that. Rarely there's environmental factors that contribute to that phenomenon. Nothing for AVMs. AVMs are purely genetic. For aneurysms, sometimes smoking can increase your risk to form a brain aneurysm. But short of that, there's not a lot of things from the environment that you can control and avoid them. But a rupture you can prevent by identifying the problem before it ruptures and treating it and changing somebody's life forever.
Final question, Dr. Bekelis. What are the misconceptions of an AVM and aneurysm?
So I think the biggest, not so much misconception, but the biggest problem with AVMs and brain aneurysms is that people don't know about them. If you mention an arteriovenous malformation out in the community with friends that maybe don't know your story, I don't think they will know what you're talking about. They're very rare diseases, and the people don't really know about them, and it takes a dramatic event. It takes a tragedy, an aneurysm rupture, an AVM rupture, for somebody to really recognize that and like you, make it their mission to spread the word and get people involved. And so that's the biggest challenge. And sometimes in the medical community, in the past, I think now that this has been overcome, but in the past, folks took a little bit more conservative approach in terms of repairing those arteriovenous malformations or the aneurysms until either they were very large or very symptomatic. And I think that pendulum has swung very dramatically in favor of trying to address these problems before they become substantial. The reason being, when they do become substantial, sometimes there's no turning back. When an aneurysm or an AVM ruptures, a large number of those ruptures will be fatal immediately. Patients will not make it to the hospital. So now the medical community is very much aggressively trying to address those issues.
Dr. Bekelis, I thank you so much for coming on the show. I thank you so much for the hot seat answers. But now is your time to shine. Whatever you want to say, whatever you want to close out with, please, the floor is yours.
Thank you, Greg. Well, it's a unique pleasure to be with you tonight. Talking to survivors is something that we don't take lightly at the Stroke and Brain Aneurysm Center, and it's at the core of what we do. We take care of a lot of patients, and we're very happy to see that folks can survive such a devastating event. But certainly, I'm very appreciative of the opportunity to use your platform to spread awareness, and that's one of the most important things we do. Like I've said before in this interview, what we do is relatively easy on the back end. Identifying the problem before it's substantial and then fixing it, that's the whole battle. And awareness is important, and I encourage you to continue what you're doing. You might not see it all the time, but what you're doing is much more important than what we do on the back end. Without your work, it is the truth, though. Without your work and Gina's work, and the lack of awareness will result in more fatal ruptures, and people will never get care. Again, on the back end, we can take care of pretty much any AVM or aneurysm, but what happens in the front end, understanding the problem, identifying the problem, spreading the word to the community, to people that have never heard of these diseases, is really the whole battle. And as far as we're concerned, we love to hear from survivors. We love to hear from patients. We're always available. Reach out to our support group. You can find information about that at strokecarelongisland.com and other information about our program. But certainly, we welcome people to join our support group regardless of where they receive treatment. We urge families to come and join our support group if they've lost their loved one, or even if their loved one survived but doesn't want to come to the support group. Sometimes families are traumatized also, and so we would want them to join us also. So again, great work. Thank you for having me, and I'm looking forward to working with you in the future.
Thank you, Dr. Bekelis. First of all, everybody, please know that Dr. Bekelis and his crew is ready and willing to help you out. Can you give them the information again one more time?
Yeah, so they can find all the information about our center online at www.strokecarelongisland.com, and we're looking forward to working with you.
Thank you so much, Dr. Bekelis. Guys, remember, October 29th is Stroke World Day. So if you want to get some information, there's a lot of us putting information out there on Instagram, Facebook, TikTok, YouTube. You can find information about it. This month, October, was AVM Awareness Month. September was Aneurysm Awareness Month, and May is Stroke Awareness Month. So all those months, we have information given out to you, and obviously this stuff happens any day of the year. So anytime that you want information about me, you want information about Dr. Bekelis, please contact us, and we'll be healthy and ready to help you guys out. Thank you guys so much. Love you guys. Dr. Bekelis, thank you so much. Hopefully we do this again. Have a good night, sir.
Thank you, Greg. Take care.
Bye.